Let's focus now on those agents that are active against herpes. Especially, let's focus on what we call thymidine kinase agents. Now, these agents are important in the nucleic acid synthesis portion of antiviral therapy. These thymidine kinase-dependent agents include acyclovir and ganciclovir. They are active against HSV1 and HSV2 as well as varicella zoster. They have a very short half-life and they are often administered 3 to 5 times a day. Now they are renally excreted as well. So we do adjust the dose in renal failure. Let's have a look where they work on our slide here. Now, as we are going through the production of DNA, we have several steps. Now, the host kinases are acted upon acyclovir and ganciclovir to prevent the diphosphate form of these agents from being produced. There are competitive substrates for DNA polymerase, and they lead to chain termination after incorporation into the DNA because they are defective agents, because they cause a defect in the actual DNA. You are unable to continue production of the DNA chain itself. That's why we call it a chain termination. Now, Valacyclovir or Valchex is a project of acyclovir. So you can see here that I have pasted it in a little pink box above acyclovir and ganciclovir. Now, Valacyclovir is able to achieve 3 to 5 times greater concentration levels, and it also lasts a lot longer. So, for the most part, it's replaced acyclovir as a means of therapy for certain types of disease. Pencyclovir actually works at the level of the DNA polymerase, so it doesn't cause chain termination, but what it does is it inhibits the production of DNA. Now, famciclovir is converted to pencyclovir by the liver. So once again, I put this project form in a little pink box just under the pencyclovir. Ganciclovir is a guanine derivative. Acyclovir is a guanine derivative, so you can see how they are acting as slightly different agents within the DNA molecule. Now, when we are looking at these agents, we know that they are inhibiting DNA polymerase inside cytomegalovirus and HSV alike. They are used in CMV retinitis and other CMV infections in patients who are immunocompromised as well. The toxicity of these agents include leukopenia, thrombocytosis, and leukocytis. Now, there is another agent that is a project that I just wanted to mention quickly. Well, ganciclovir is a project of ganciclovir. It has a very high bioavailability and a longer half-life. So I anticipate that this is going to be something that will come onto the market quite strongly and start to replace the ganciclovir. Now, when you take a look at all of these drugs and just sort of slow them into a class as a whole, the toxicity that we are concerned about is GI distress and nephrotoxicity. So these are present in significant numbers enough that we have to keep a very close eye on them. With most antiviral agents, you are going to have some kind of neurological side effects. So we talk about headache, tremor, seizure, sometimes delirium as well. In terms of bone, there was a concern that there would be an effect on bone marrow, but we are actually not seeing that play out in real life. How do agents develop a resistance to drugs like acyclovir? It will occur in two different ways. The first way is a change in the viral DNA polymerase. So obviously, if there is a change in the target molecule, the drug won't work as well on that target molecule. The other way that it will work is that some strains of virus actually lack the thymidine kinase that it is active upon. So this can be a viral specific phosphorylation of acyclovir, and these agents will be cross-resistant to each other. So you have to be aware that there is multiple ways of resistance, and these are the two. Let's move on to host kinase agents. Now, host kinase agents are going to work on several areas of function, but mostly we are going to be focusing on the late protein synthesis processing of the virus. So cidofovir is activated by host cell kinases. Cidofovir is activated by host cell kinases. Is active in herpes simplex virus infection, cytomegalovirus, adenovirus, and others. It doesn't require viral kinase. It's active against many resistant viruses. The activity we use it against CMV, retinitis, and mucocutaneous herpes simplex virus. The activity we use it against CMV, retinitis, and mucocutaneous herpes simplex virus, and sometimes we will use it against genital warts as well. The toxicity that we are most concerned about is really nephrotoxicity. So this important to monitor renal function in patients on these agents.